Hi, I'm Cris. I'm the founder of International Headache Center, and I am a neurologist and a headache specialist. I just got done with a very lovely conference that inspired me to make this video because of the questions that I always get. Firstly, it is totally cool if you have no idea what a headache specialist does. There are members of my family who still wonder what I get up and do every morning. So a headache specialist is someone who has had special training or has special interest in headache and facial pain conditions. Secondly is there is no such thing as a regular headache. A headache is a symptom. It's discomfort or pain in the head, so the neck up. And if you have headaches you can remember, recurrent headaches, especially if they're frequent, then you probably need to seek medical attention to make sure that there's not an underlying cause. And what we try to do is figure out, is this a primary headache condition, meaning one you're genetically predisposed to get, like migraine, which is a neurological condition, or is this a secondary headache condition, so something underlying the headache that's causing it to manifest? And if that's the case, then we treat that underlying factor. So the next thing is okay, well, what can I do to help with headaches at home? Because they don't want to come see me in clinic. And so it's okay. Not everybody wants to go and see a headache specialist. And there's actually things that you can do for headache prevention and symptomatic relief that are not prescription remedies. And some of those things can also help with general brain health, which is good for all of us to do. So the main word is consistency. So as consistent as you can keep your schedule and your routine, the better your brain will love you for it. First is sleep. Wake up at the same time every day. Go to sleep at the same time every day. Get the same amount of sleep every day, whatever amount is good for your body, somewhere between 6 to 8 hours, sometimes a little bit more, sometimes a little bit less. But just keeping that into the routine. If you have a job where you do shift work or you're on call, then making it as regular as possible. And then if you need to, taking a nap, 10-20 minutes to make up for lost sleep. Next is nutrition, which is a loaded term. It means a lot of things. Firstly is scheduling your meals and making them a habit. Don't skip meals. And that's different for everybody. Some people like several small meals during the day. Others like a big meal and then small snacks to carry them through. Whatever is good for your body, make sure that you have that planned out and that you stick to it. And then adding brightly or deeply colored fruits and vegetables that are filled with antioxidants into every meal so that they're pulling that badness out. If you can and you're not a vegetarian, adding fish once or twice per week could be very helpful. And I'm not saying a fancy fish, even something like tuna could be helpful. If you are a vegetarian, then you can supplement that through nutraceuticals. Next is exercise. So exercising, walking, recumbent bike, yoga, whatever the exercise is that you like to do, doing that for 20 to 30 minutes every single day. And if you wanted to do 1 hour 3 times a week, that's okay. But I tend to ask patients to do it every day, because if you miss a day, then it's not so bad, right? But if you're only doing it 3 times a week and you miss a day, then you've just lost a third of your exercise routine. Next is hydration. So depending on your body weight, about 2 liters per day. Making sure that you carry a bottle of water with you. And if you need to, some electrolyte mix in order to keep the fluid where it needs to be. Another thing is playing brain games. Brain games are intended to use parts of your brain that you might not be using during the workday. And so things like playing along with Jeopardy for an hour at night, or trying an app like Luminosity or other brain games that are on the internet Even things like Sudoku or crossword puzzles can be helpful to do. Don't get frustrated by the brain games. Do things that are challenging but fun, and then work your way up. Next, as far as things that you can do every day, is meditation, mindfulness, relaxation, especially progressive relaxation. So I have patients go to YouTube and listen to a video called 8 Minutes to Calm. It's progressive relaxation where you take a deep breath in, feel the air go down to your toes, and then relax. Relax your toes and then all the way back up. That can be done scheduled, but also as needed. If you get anxiety or if you have a headache, then you can do it again. And finally, making sure that at least once a week we do volunteer and social activities. We want to keep our brains active and have that sense of community as well. And so keeping conversations going more than just what's for dinner tonight, and going out and doing social activities helps with that. So the next things I'm about to say are more specific to migraine, and I am not trying to diagnose or treat any medical condition. And before we embark on any new program with nutraceuticals or exercise plan or what have you, please make sure that you discuss this with your healthcare professional. So there are 3 supplements that I tend to recommend for migraine prevention that have been evidence-based. The first is coenzyme Q10. It is an enzyme used by the mitochondria, which is the energy-making part of the cell, to make energy. And so it's good for organs that take a lot of energy, like the heart and the brain. Coenzyme Q10 is 300 milligrams daily. It usually doesn't have any side effects, but sometimes it can cause nausea. If that happens, then you can take 100 milligrams 3 times per day. The next one is riboflavin, 400 milligrams daily. This is B1, and it really does not have any side effects, but it will make your urine neon yellow. And so stay hydrated and just know that it's the riboflavin. The third one is magnesium, 500 milligrams. And there's different formulations. I tend to use citrate or bisglycinate, but oxide is also available. Magnesium, 500 milligrams daily, can cause diarrhea. If that happens to you, you can cut the dose in half or take it every other day. Magnesium is better taken at night. It can have a calming effect, sometimes make people sleepy, sometimes even decrease the blood pressure, but you can take it, whenever is a good time for you. You don't have to take it at night. So that's kind of in a nutshell for preventative things, good for your general brain health, good for migraine in specific as far as headache prevention goes. The next thing is sometimes people are like, well, I don't need a supplement or whatever that I take every day. I just have these flare-ups when the spring comes or when I'm in a more stressful bout that I get headaches. What can I do? So one simple thing to do that's over the counter is to take an antihistamine, a long-acting one like Zyrtec. Take it for a few days to a few weeks, up to 6 weeks, to kind of bridge you through this tougher period. What antihistamines do is decrease the inflammation, and we know that there is an inflammatory component to headache syndromes. The next thing is talking about symptomatic treatment. So when you have an attack, a headache attack, then what do? NSAIDs, if you're able to tolerate them and they're not contraindicated for you, tend to do very well. And things like naproxen taken with caffeine and maybe some Gatorade can help get rid of a headache. It's best to take symptomatic treatment when your headache first starts and to blow it out of the water instead of waiting and trying to push through to see if the headache will go away. The thing about symptomatic treatments is you should limit them to about 9 days per month, so 2 to 3 24-hour periods in a week. And this is because if you take them too often, then you can get something called medication overuse headache or rebound headache that then makes it more difficult to treat the headache condition. So it's really important here because I think we're all pre-programmed to take as little medicine as possible and to try to push through everything. But with the brain, you don't want to do that. With the brain, the more time in pain, the more pain. The faster, the stronger that circuit. And so the less time in pain, the less pain. And so we want to break the headache cycle, and we don't want to teach the brain to have pain. And that's why we're talking about taking the symptomatic medication to blow the headache out of the water, if you will. One thing you could add to the naproxen and the caffeine and hydration is Benadryl, but be mindful that Benadryl can make you sleepy, and then taking too much Benadryl, frequent use has been linked with dementia, so you don't want to do that. So these are the main things I wanted to talk about, just to have treatments out there, but also give everyone some hope that there's new treatments coming along the way. That's very exciting. There's lots of organizations doing great things to increase awareness for migraine and other headache conditions, and provide support to those who have migraines and their loved ones. There's a list of headache specialists on the American Migraine Foundation website. You can find resources on their website, but also there's My Chronic Brain, Shades for Migraine, American Headache Society, National Headache Foundation, and Miles for Migraine, and I'm sure there's others I missed, but there's lots of organizations where you can find support materials. If you'd like to reach out to International Headache Center, the great thing is that we're nationwide, and so you can check out our website. It's internationalheadachecenter.com, and that way you can find out more. Thanks for listening.